gonna dine with kings.
So what is a psychometrist?
Ooh, throw out that hard one.
It's not something people hear about.
No, it's not. It's very niche. Technically, it means I measure psychological functioning. So in this setting, I am assessing changes in attention, memory, problem solving, that sort of thing, and comparing it to what we expect someone would have been functioning at before an injury, and then comparing to like what they are right now when we do the assessment. So in the rehab setting.
Right. So is that difficult then? Because not knowing where the individual was previously?
It takes a lot of legwork. We do a lot of assumptions on where someone would be pre-existing, based on like age, education, ethnicity, socioeconomic status, and we just kind of put it on like a bell curve with norms that we have from across North America. So we expect someone of like your age and all of those things to be like between this point and this point, and then we measure where you were when you were here compared to where we thought you would have been prior.
Right, based on averages.
We compare current functioning to an average. Exactly.
Okay. Does that make it challenging? Not because everyone's so different, right?
Yeah, we definitely have to make that assumption that everyone is at average unless we know otherwise.
Right.
So if someone is like, if English is someone's second or third language, we would drop what their average would be pre-existing because we would expect it to be a little bit lower because they're not a first language English speaker.
Right.
If we know someone that has a pre-existing mental health diagnosis or a pre-existing learning disability, that kind of changes where the average is. Okay. But yeah, for the most part, we assume like you're right at the top of that bell curve in that prior to the injury.
And then what do you do with that information?
So it's different for everybody. What we did with you was we spent a couple weeks like assessing in detail, like where is your memory at, like the day of. So we did it like a month before you left, I think. Yeah. So what was that, 7 months ago? We assessed your memory and we assessed your attention and we assessed your ability to read language, understand language, your ability to interpret like visual images without words attached to them, and kind of put it all together. Everything we assess twice, but sometimes it's like a huge shift, and sometimes we have to go, oh no, this person cannot safely go back to work, or this person cannot safely make these, like, say, financial decisions, things like that, or this person won't remember to take their medications. Like, it'll be like we can apply the results from that test to like life functional situations.
We're gonna dine with kings. We'll have the finest thing.